Hello everyone, let us discuss about triad in medicine. We will discuss around 40 triads. First we have acute bacterial meningitis. The triad consists of high grade fever, change in mental status, and knuckle rigidity. There might be presence of Brzezinski sign and Cornick sign. Next is Parkinson disease. We have tremor, bradykinesia, rigidity. We can remember by the mnemonics RRR, restrained tremor, reduced movement, and rigidity. Next, we have Miller-Fisher syndrome. It is the one of the variant of GBS. The triad is ataxia, areflexia, and ophthalmoplegia. Next, we have Wernicke's encephalopathy. It occurs due to the deficiency of vitamin B1. We have the triad encephalopathy, ataxia, and ocular dysfunctions. Next, we have Plummer-Vinson syndrome. This occurs due to the iron deficiency anemia. We have the triad esophageal wave, splenomegaly, and koilunica. Koilunica means spooning of the nail. Next, we have Ritter syndrome. The triad consists of reactive arthritis, conjunctivitis, and urethritis. We can remember by the mnemonics can't see, conjunctivitis, can't pee, urethritis, can't walk, arthritis. Next, we have the primary myelofibrosis. It consists of triad of teardrop poikilocytosis, giant abnormal platelets, and leukoerythroblast in the blood. Next, we have pheochromocytoma. This consists of the excessive sweating, episodic headache, and tachycardia or palpitations with hypertension. Next, we have diabetic ketoacidosis, which consists of the hyperglycemia, metabolic acidosis, and ketonuria. Next, we have hypocalcemia, carpopedal spasm, convulsion, stridor. Next is prion disease, corticospongiform changes, gliosis, and neuronal cell loss. Next, we have Bicross triad, endothelial damage, hypercoagulative state, status of the blood. Next, we have Zurich-Strauss syndrome, asymmetrical mononeuritis multiplex, eosinophilia, and skin changes like purpura and nodules. Next, we have tuberous sclerosis, skin changes like Asliff macule, adenoma sebaceum, learning disability, and epilepsy. Next, we have depression, negative view of self, negative view of the current life experience, negative view of future. Next is viral hemorrhagic fever. It consists of fever, hemorrhage from the GIT, and shock. Next, we have paroxysmal nocturnal hemoglobinuria, which consists of hemolysis, tendency of the venous thrombosis, and pancytopenia. Next, we have Felty syndrome, which consists of the neutropenia, splenomegaly, and rheumatoid arthritis. We have dyskeratosis congenita, which consists of the mucous membrane leukoplakia, dystrophic nails, aplastic anemia, and reticular hyperpigmentations. Next, we have disseminated candidiasis, which consists of fever, eruptive nodules, and myalgia. Next, we have brain abscess, which consists of headache, fever, and the focal neurological deficit. Next, we have hemolytic uremic syndrome, which consists of the microangiopathic hemolytic anemia, acute renal failure, and thrombocytopenia. Next, we have Wells syndrome, which consists of jaundice, AKI, acute kidney injury, and hemorrhage. Next, we have Rocky Mountain spotted fever, which consists of the history of the tick bite, rash, and the fever. Next, we have congenital rubella syndrome, which consists of the cataract, heart defect like PDA, and sensory neural hearing loss. Next, we have pericardial effusion with cardiac tamponade, which consists of the sinus tachycardia in the ECG, electrical ordinance in the ECG, and low voltage QRS in the ECG. Next, we have heavy metal nephropathy, which consists of the saturine gout, renal insufficiency, and hypertension. Next, we have hepatopulmonary syndrome, which consists of the pulmonary atrioventricular shunt, hypoxia, and the liver disease. Next, we have aspirin exacerbated respiratory syndrome, which consists of asthma, respiratory reaction to the COX-1 inhibitors like aspirin, and rhinosinusitis. Next, we have McCune-Albert syndrome, which consists of the polystatic fibrous dysplasia, peripheral precocious puberty, and the caffeolate spots. Next, we have systemic sclerosis, which consists of the widespread capillary loss, fibrosis of the skin and internal organs, and obliterative microangiopathy. Next, we have Whipple's triad. It is the triad for hypoglycemia. There is the symptoms of hypoglycemia. Treatment. There is a response with the treatment, and there is a lab glucose, less lab glucose. Next, we have Marfan syndrome, which consists of skeletal changes like long and thin extremities, loose joints, aortic aneurysm, decrease in the vision, due to the superior and the superior lateral dislocation of the lens. Next, we have heat stroke, exposure of the heat, core temperature more than 40.5 degrees Celsius, and CNS dysfunctions. Next, we have Lennox Gastaut. There is decrease in the cognitive functions, multiple seizure episodes, and EEG shows slow spikes wave discharge less than 3 Hz and others. We have Kern-Sauer syndrome, which occurs for which occurs in less than 20 years. Chronic progressive external ophthalmoplegia with pigmentary retinopathy. Next, we have infectious mononucleosis, which consists of fever, lymphadenopathy, and the pharyngitis. Next, we have bronchial asthma, which consists of dyspnea, wheezing, and the cough. Next, we have Horner syndrome, which consists of the ptosis and hydrosis and meiosis. We have Ramsey-Hunt syndrome, which causes ipsilateral lower motor neuron type of facial palsy, vesicles in the auditory canal and the auricles, and ear pain. Next, we have portal hypertension, which results in varices, splenomegaly, and ascites. We have hemolytic anemia, splenomegaly, and the jaundice. Next is Budd-Chiari syndrome, abdominal pain, hepatomegaly, and ascites. Next is tetanus. There may be reflex spasm, muscle rigidity, and trismus. Next, we have Ortison's triad, which consists of the notched upper incisor teeth, sensory neuron hearing loss, and interstitial keratitis. This occurs in the congenital syphilis. Next, we have bronchial asthma, which consists of the airflow obstruction, inferior of the lower respiratory tract infection of the lower respiratory tract, and bronchial hyperresonance. Next, we have Argyll-Robertson pupil, which consists of the normal visual acuity, direct pupillary reflex is absent, and accommodation reflex is normal. Next, we have neuroblastoma, which occurs in the children. It consists of abdominal mass, fever, and bone pain with IBC intramegaba thrombosis. Thank you.